Now, we think of menopause as a single entity, but that is really not the case. So women go through menopause for different reasons. Usually when we talk about menopause, we're thinking spontaneous menopause, which is part of the aging process. Just your ovaries run out of follicles, and eventually you stop making these hormones, and then you just transition to menopause, which is not a piece of cake necessarily, but it's the gentlest way, it's the most gentle way to go through menopause. Many women, unfortunately, go through menopause for other reasons. Some women have something called POI, primary ovarian insufficiency, which is when you develop menopause before age 40 or 45, so quite early on in life. That could be due to genetics, to autoimmune conditions, or to medical interventions that impact the onset of menopause. So sadly, 1 in 8 women in the United States undergoes a hysterectomy, which is the surgical removal of the uterus with or without the ovaries, and about half of those women undergo hysterectomy before menopause. That can prompt surgical menopause at any age. Can happen when you're a teenager, if you have the ovaries removed at that time. Yes, can happen in your 20s, in your 30s, in your 40s, any age before menopause. Because it's a surgery, the ovaries are gone, then the onset of menopause is obviously abrupt, it's rapid, and the consequences might be more severe. So the symptoms might be more severe, and the health risks the menopause can bring about are also more severe. That's very important to consider because we don't do that enough.
Is there a study that tracks women who have had hysterectomies and developed Alzheimer's later in life?
Yes.
And what does that ratio look like?
Well, what these studies show is that women who undergo menopause because of surgeries have a higher risk of Alzheimer's disease and dementia compared to women who go through menopause spontaneously. The risk is just a little bit higher if only the uterus is taken out, but is significantly higher if the ovaries are taken out before menopause.